For most of us, when the light levels are higher, we experience an increase in energy. People tend to be more active. We see some people experiencing less levels of depression and anxiety, but for others, increased levels of light can negatively impact their circadian rhythms, their daily physiologic rhythms, things like their sleeping patterns, their eating patterns. There are some people that really struggle, particularly during the summer where it gets dark quite late. They struggle with falling asleep or staying asleep. When people are exposed to sunlight, it stimulates changes in the body, specifically in the brain, and the secretion of a hormone called melatonin that's associated with exposure to light, usually sunlight earlier in the day. And as light levels fall, melatonin levels fall later in the evening. And so, as you can imagine, during our summers, when we get more sunlight later into the evening, this can result in prolonged levels of high melatonin for people. Sometimes we actually use sunlight to treat people who are struggling with depression and anxiety, people with seasonal affective disorder. So sunlight has a direct biological effect that's important to recognize. For most people that are sensitive to light levels, having exposure to light early in the morning is good for setting your circadian rhythms for the day. So trying to get 10 to 15 minutes of sun exposure or sunlight exposure in the morning is positive. And then minimizing sun exposure before bedtime is helpful. So if you find that you have difficulty falling asleep when it's brighter, doing things like having blackout curtains or blinds to reduce sun exposure or reduce your light exposure before you go to bed can help your body get ready for sleep.